The American Society for Aesthetic Plastic Surgery reports that more and more seniors are looking to turn back the clock as they live longer and healthier. Nose reshaping, eye and brow lifts, and facelifts dominate the chosen procedures among this generation of seniors who are particular about their presentation. Dr. Dino Madonna of Lake ENT delves into the options that facial plastic surgery provides and the delicate balance between art and function.
Facial plastics has a couple branches where it's cosmetic and then reconstructive, and sometimes they actually even overlap. The two most common things that kind of overlap are noses, where a lot of times there's a component of nasal obstruction where there's a collapse of the nasal valve region as far as that allows air to valve in when you breathe. You include deviated septums with that and enlarged turbinates. Those are kind of obstructive features in the nose. And then in addition, quite often you'll find someone at the same time, like if you're going to have that done, I'd always want it to change the shape of my nose. You know, it may be crooked, you may have a hump, you may want the tip refined a little bit and made more narrow. I mean, there's just, so that's more the cosmetic part, but a lot of times they'll intertwine. The other one that commonly intertwines are the upper eyelids and brows. If your brows sag and there's excess skin of the upper eyelids, it'll be so low enough where it'll affect the visual fields or the peripheral vision. And that has to be kind of supported or documented by a visual field test. And if it shows that it has a significant improvement by lifting that tissue out of the way, then it becomes a functional or medically necessary type procedure, although still elective. As far as more strict cosmetic procedures, we got face and neck lifts, which are basically tightening up of the tissues of the jowls and the neck waddle in order to kind of lift and rejuvenate the effects of Father Time and what gravity's toll on the tissues. There's a whole host of laser techniques for rejuvenation, whether it's skin resurfacing, facial hair, rosacea, or the redness can also be treated with laser. Facial pigmentation, brown spots can also be treated with laser. Again, more along in the lines of the whole facial rejuvenation, you can have stuff where you do chin implantation for chin implants to kind of improve the profile. That's quite often in combination with facelifting because you're improving the profile with the neck angle. Oftentimes with rhinoplasty in order to kind of balance out the symmetry of one's profile. Not only do you address the rhinoplasty, but you also address the chin or see if the chin needs further augmentation. So the idea of form and function and the artistry and three-dimensionality that goes with it, to me is just fascinating, very rewarding.
For more information on this story, as well as links to the specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Fresh Faced Seniors story link on our homepage, yourhometownhealth.com.